The next document is a crown and fixed bridge consent form, which we provide to all our patients prior to fitting their final work. At the top of this document, the tooth number or teeth numbers needs to be filled in. I understand that the treatment of dental conditions requires crown and fixed bridge work, includes certain risks and possible unsuccessful results, with even the possibility of failure. I agree to assume those risks, possible unsuccessful results and/or failures associated but not limited to the following: reduction of the tooth structure in order to replace decayed or otherwise traumatized teeth. It is necessary to modify the existing tooth or teeth so that crowns or caps or bridges may be placed upon them. Tooth restoration will be done as conservatively as practical. In preparation of the teeth, anesthetics are usually needed. At times there may be swelling, jaw muscle tenderness, or even a resultant numbness of the tongue. Lips, teeth, jaws, and/or facial tissues, which is usually temporary or very rarely permanent. Sensitivity of teeth. Often, after the preparation of teeth or the reception of either crowns or bridges, the teeth may exhibit sensitivity. It may be mild to severe. This sensitivity may last only for a short period of time or may last for much longer periods of time. If it is persistent, notify us, as such as this sensitivity may be from some other source. Crowned or bridge abutment teeth may require root canal treatment. Teeth after being crowned may develop a condition known as pulpitis or pulpal degeneration. The tooth or teeth may have been traumatized from an accident, from deep decay, extensive preparation, or other causes. It is often necessary to do root canal treatments in these teeth. If teeth remain too sensitive for long periods of time following crowning, root canal treatment may be necessary. Infrequently, the tooth or teeth may abscess or otherwise not heal, which may require root canal treatment, root surgery, or even possible extraction. Breakage. Crowns and bridges may possibly chip or break. Many factors could contribute to the situation, such as chewing excessively hard materials, changes in the biting forces, traumatic blows to the mouth, etc. Unobservable cracks may develop in the crowns from these causes, but the crowns and bridges may not actually break until chewing soft foods or possibly for no apparent reason. Breakage or chipping seldom occurs due to defective materials or construction unless it occurs soon after placement. Uncomfortable or strange feeling. This may occur because of the differences between the natural teeth and the artificial replacements. Most patients usually become accustomed to this feeling in a short period of time. In limited situations, muscle soreness or tenderness of the jaw joints, temporomandibular joint, may persist for an indeterminate period of time following placement of the prosthesis. Aesthetics or appearance. Patients will be given the opportunity to observe the appearance of the crowns or the bridges in place prior to the final cementation. Longevity of the crowns and bridges. There are many variables that determine how long crowns and bridges can be expected to last. Among these are some of the factors mentioned in the preceding paragraphs. Additionally, general health, good oral hygiene, regular dental checkups, diet, etc. can affect longevity. Because of this, no guarantees can be made or assumed to be made. It is a patient's responsibility to seek attention from the dentist should any undue or unexpected problems occur. The patient must diligently follow up any and all instructions, including the scheduling and attending all appointments. Failure to keep the final cementation appointment can result in the ultimate failure of the crown or bridge to fit properly, and an additional fee may be assessed. Alternatives to crown fixed bridge work. Depending on my diagnosis, there might be alternatives to the crown and fixed bridge, such as extractions, dental implants, direct restorations, removable partial dentures, etc. No treatment. I may choose to not have any treatment performed at all. If I choose no treatment, my condition may worsen and I may risk serious personal injury, including severe pain, localized severe pain, localized infection, loss of this tooth, and possible other teeth movement of the opposite and adjacent teeth, and tooth fracture. I acknowledge that I have been provided an accurate medical history, will follow treatment recommendations, and have had the opportunity to ask questions about the risks of continuing with fixed crown and bridge treatment. And finally, the patient's signature, the date and time, and then this needs to be scanned and added to the patient's file. If a parent or guardian, there should also be a witness, and this needs to be dated as well. And finally, the health provider's signature and date.